Committee on State Affairs will come to order. Will the clerk call the roll?
Campbell. Hall.
Here.
Lucio.
Yo.
Nelson. Powell. Shortner.
Present.
Zaffarini. Birdwell. Hughes.
Here. Quorum is present. The chair now lays out House Bill 1535 by Representative Click and recognizes its sponsor, Senator Shortner, to explain the measure. Senator Shortner.
Thank you, Mr. Chairman. And members, this bill is a bill about the compassionate use program in Texas. This program is a heavily regulated program in our state and specifically tailored to treat debilitating conditions such as severe seizure disorders, multiple sclerosis, and terminal cancer with low concentration THC, cannabis, CBD oils. Following the passage of the federal farm bill, patients in Texas have turned to hemp products with little or no regulation. As a pharmacist and as a physician, I feel strongly that our limited medical program with appropriate rules and oversight is the right path for patients in Texas seeking symptom relief. I believe the evidence is starting to show that. I believe there needs to be further work on that, but certainly the testimony is very strong by patients suffering from some of these conditions. The bill in its current form that came over from the House extends the program to all cancer patients, not just terminal cancer patients. It also extends the program to patients with chronic pain, PTSD, and other debilitating conditions. The bill goes even further in raising the low THC percentage from 0.5 to 5%. And third, the bill created a medical cannabis research program under HHSC so that our state can provide and determine its own validity regarding treatment programs, relief, and product efficacy. There is a committee sub, Mr. Chairman.
Senator Shortner sends up a committee substitute. Chair recognizes Senator Shortner to explain the substitute.
With input from members and discussion about how aggressive we should about taking further steps, the substitute offers a enhancement of the program, but does change the bill from its engrossed version by changing the low THC percentage from 0.5 to 1% instead of the 5% that came over from the House. The bill also changes and broadens the program to include all cancer patients and patients with PTSD only, and it otherwise maintains the aspects regarding the research program. Thank you. I'll be happy to answer any questions regarding the substitute or bill.
Thank you, Senator. Members, any questions for Senator Shortner on the substitute? Senator Birdwell.
Thank you, Mr. Chairman. Members, Senator Shortner, on the PTSD aspect, is there a certifying body that, what's the determination that validates that somebody has PTSD? Is there a certifying official, I guess would be the generic term I would use?
PTSD is a neurologic and psychiatric disease that often those two neurologists, psychiatrists diagnose. There are criteria, Senator, but as just a bone surgeon, I am not advised of the specific criteria that are utilized to determine the diagnosis of PTSD. Right. Certainly, we've seen that going all the way back to the Iraq War, and the prevalence of it is certainly in our veterans is significant. I think I can get you more information, Senator, but I don't have the specifics as to the determination of PTSD diagnosis.
Okay. No, I just want, what I'm seeking is to make sure that we've got a pretty hard box around that to make sure that a PTSD diagnosis is certifiable, or not just simply the complaint itself is the primary concern.
I think it's certainly recognizable and diagnosable.
Because it's real. I'm just trying to make sure that it's in a tight box of the making sure that the request for treatment related to PTSD, there's a certified need, whatever, again, certified in a generalist verbiage to make sure that the medical professionals are validating the need for it. Second is the regulatory box with DPS being the dispensary right now. Is that still maintained? Is the
various requirements regarding the regulation of this program are not changed in this bill.
Okay. All right. Thank you, Mr. Chairman. Thank you, Senator.
Thanks, Senator Birdwell. Senator Zaffarini.
Thank you, Mr. Chairman. Senator Shortner, do you have any information regarding how public attitudes about this issue have changed over the years?
I think public awareness, I don't have, what I have is being an elected official, and as far as just the overall knowledge and acceptance and thought that THC and CBD oils can offer benefit without having to resort to other pharmacologic agents, chronic opioids, antidepressants, other things that anti-anxiety medications. People have given certainly lots of testimonial types of discussion over the last 6 years. I've been aware of this and have worked with authors, including Senator Campbell, to put this in place. But I think it is a much more aware program and aware treatment option, and as such has more validity, and that's why I'm offering this bill to allow for further leniency regarding the classifications that can be treated as well as the concentration that can be utilized.
And do you have any information regarding whether this is already being done, even though we have not passed the law yet?
I would suspect it is already being done. Some states have more lenient laws regarding this. Certainly with seizure patients, I remember specific testimony of very severe seizure patients that were traveling to other states for treatment of their intractable seizure disorders.
Thank you. Thank you, Mr. Chairman.
Mr. Chairman.
Thank you, Senator. Senator Campbell.
Thank you, Mr. Chairman, and thank you, Senator Swartner, for bringing the bill forward. To try and, because I agree with Senator Birdwell, I mean, this can be, PTSD can be a big box with, different people expressing that they have PTSD for multiple reasons. But DSM-5, which is a category, is a diagnosing categories from the American Association of Psychiatry, or whatever they'd call that. There are multiple criterions that somebody with PTSD has to meet, not just one. So they've got criterions, I think, A through H or through G, something like that. And whoever is putting the diagnosis on there, they've got to be able to get the criterion in to define it as PTSD. It doesn't mean they don't have a stress disorder or something else, but trying to do, like you said, try to put that box around, borders around it, so that the real definition could be determined. That is out there. Thank you, Mr. Chairman.
Thank you, Senator.
Senator Campbell, thank you. Members, any other questions? Senator Hall? Okay. Any other questions for the sponsor? Very well. We'll open public testimony on Committee Substitute House Bill 1535. Public testimony is open. Anyone wishing to testify on, for, or against House Bill 1535, the committee substitute that Senator Shortner just laid out. Anyone wishing to testify on, for, or against? Hearing and seeing none, public testimony will be closed at this time. Senator Shortner moves that Committee Substitute House Bill 1535 be reported favorably to the full Senate.
Senator, do we need to adopt the?
Oh, Senator, that's a good idea. We should adopt
We should open up
before we
public
try to do
testimony
that.
for the subs. I don't know. We need to redo that.
We got that on the substitute, and we have not adopted it. Thank you. Thank the senator and our able clerk. So, Senator Shortner moves that we adopt the committee substitute laid out previously, which he explained. Any objection to that? Hearing none, the substitute is adopted. And now, thank you. Senator Shortner moves that the committee substitute to House Bill 1535 be reported favorably to the full Senate with recommendation that it do pass and be printed. Will the clerk call the roll?
Campbell. Hall. Lucio.
Aye.
Nelson. Powell. Shortner.
Aye.
Zaffarini. Birdwell. Hughes.
Aye. There being 8 ayes and no nays, committee substitute to House Bill 1535 will be reported favorably to the full Senate. And senators, we have a motion in writing from Senator Powell, who was, of course, here. And without objection, that will be adopted. Any other business for the Senate Committee on State Affairs?
Thank you, Senator.
Thank you very much. We'll stand in recess up to the call of the chair. Good evening.